can't hear the song, Always Something There to Remind Me, without remembering my first autopsy. It was playing on the radio, and one of the techs sang along while we put on scrubs, long-sleeved plastic aprons, shoe covers, face masks, face shields, and finally, gloves. I learned a great many things that day, but the one that most concerned the singing tech was that I learned how to properly put on, take off, safety gear. He was the one who first taught me how important it is to health and safety to choose the right disposable glove for a task and use it hygienically. In many professions, from medical examiners to construction workers to cosmetologists, gloves are personal protective equipment required by the Occupational Safety and Health Administration, or OSHA. OSHA defines personal protective equipment as specialized clothing or equipment worn by an employee to protect them against hazardous materials. According to U.S. Bureau of Labor Statistics, 70% of people with work-related hand injuries in 2014 weren't wearing gloves, and the other 30% were wearing gloves that weren't suitable for the task. Choosing the correct material for gloves involves balancing protection with functionality. Latex are the best protection against bacteria and viruses, and the lowest interference with dexterity, which has made them very popular in medical fields for many years. However, the rise of allergic reactions to latex, which can show up unexpectedly, have made their popularity and usefulness decline in the past 10 years. Nitrile gloves provide protection against bacteria, chemicals, and punctures. So many medical institutions have switched. Vinyl gloves are cheaper and are chemically resistant, which makes them ideal for furniture refinishing or hair dyeing. Once you have the gloves best suited to your task, you need soap and water. It's important to remember that no glove provides 100% protection. So it's very important that you wash your hands before and after using disposable gloves. Once your hands are clean and dry, I have a little setup here to demonstrate how to put on and take off gloves hygienically according to the U.S. Centers for Disease Control Protocol. These are nitrile gloves. If you have a problem with the glove sticking to itself, blow a little air in it, and that will help open it up so that you can get it on more easily and quickly. Gloves tend to curl up under themselves when you put them on, so make sure that you extend the cuff when you put it on so that it fully covers the wrist. After that comes the hard part, getting your gloves off without getting what's on your gloves on you. This is some red paint I'm putting on the gloves so you can see how this works. Okay. First thing you want to do is make sure you stand over the trash and angle your hands down so that any drips fall in the trash and not on you. Then, for the first glove, pinch some of the material up at your wrist and pull it away. And gather the fingers and then pull down and let the glove turn inside out so that your skin never comes into contact with the contaminated surface. For the second glove, unlike the first, you want to slide your fingers under the cuff without touching the outside. And then, again, gather your fingers and push it down, letting it turn itself inside out and fall away. And of course, the last step is, again, wash your hands. Proper disposable glove technique can prevent infection and injury, so choose wisely and wash well. There's always something there to remind me, and now there's always something there to remind you too.